So thank you all for coming. I'd like to welcome you here. We do birth circles or women's circles about once a month or so as a smaller group. This month we have a guest speaker, Kristi. Thank you so much for coming. And so I kind of wanted to do a little bit of an introduction to the circles that we do. We kind of come together and we're able to learn often about birth, and we're able to volunteer for things in the community, and we do a lot of talking, processing, and healing. So it's just a really good opportunity for women to come together and to be able to work through things that we have to put up with in our lives.
Even sometimes it's like a birth from 10 years ago that ends up being the thing we're talking about in the processing for someone.
Yeah.
So it's really organic how the healing happens in the circles, even when we plan, a curriculum of some type, the healing seems to happen spontaneously.
So that's what happens when women get together and we're all helping each other. So we normally start our circles with a song.
So the words for the song.
Is there actually right there underneath?
Oh, okay. Somebody can grab those.
And
we might have to share.
And we will have to share drums, so everyone can kind of snuggle up with somebody else, and we'll all just kind of beat upon our little drums while we sing.
Okay. So this is just a song. This is a song that I used to sing a lot. We did this celebration called a Blessing Way a lot in Canada. It's a Native American tradition.
Where you singing the song that's at number 1.
Where you honor the pregnant mother. So you get together with her. The women sing to her. They do her feet. They do her hands. They do her hair and braids. It's kind of a neat custom. So this is one of the songs. Resurrecting it now. So, Nikki, you know it. Come sit in a circle. Just do your best. We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun. We are sisters on a journey, singing in the sun, remembering the ancient one. The women and the wisdom. The women and the wisdom. We are sisters on a journey, watching life unfold, sharing warmth of heart and hand. The knowledge of the old, the knowledge of the old. We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun.
Thank you, guys. So I'm actually going to go ahead and say the prayer for us.
Okay.
And then immediately following the prayer, we'll turn the time over and we can just take over from there. So if you want, we can all hold hands.
Thank you, everybody. It's really special.
Our dear Father, we are so grateful for the opportunity to gather together as sisters on this beautiful day. We ask thee that thou would please bless our minds and our mouths as we serve thee, that we will be able to understand the things that are being said, and we'll be able to take them into our hearts, that we will be able to easily translate the words that we want to say and be able to formulate our questions, and that we will be uplifted and that thy spirit will be with us wherever we may be on this day. Please bless the technology, that it will continue to work and that it will help to include all of the people who are far away who long to be here. We ask for thy spirit this day. In the name of thy Son, Jesus Christ. Amen.
Amen.
Amen. Well, can we have just everybody goes around says their name? Wonderful.
I'm Ruth Hell.
I just say one thing. Like, why are you here?
I'm here because I'm a midwifery student
Oh.
and I started apprenticing in 2019. I'm currently going to Neibaur midwifery school.
Wow.
Yeah,
We're so happy you're here.
I'm glad to be here.
I'm very net. Interest brought me. I've always been interested in pelvic work, /therapist. I also have bladder reconstructive surgery, which I kind of wish I didn't. But also, so pelvic floor is kind of fashion. So
Sure. I love your food.
I'm Tracy Simmons. I just really believe in how women can be together and our sisterhood is super, super important. Potent right now. So
Yeah.
I was excited to work out the group. Way, it's fine. So it was just the night to just or
We all have that in common.
Angie Phillips and just stick a pee in my pants when I see her jump or whatever else.
Yeah, I know.
So I'm Sassy Cassie,
Awesome.
and I've had 4 kids. You guys say more? So, my husband passed away from cancer 4 years ago. But this sweet lady was my doula. He was sick with cancer. He died 3 weeks after the baby was born. But she has a special place in my heart.
Cry.
So I did it without any epidural or anything. Straight up was completely naked, hot, overheating.
Wow.
But it was pretty special. It was her and another one, and
The doula makes all the difference.
well, when he was sick, I realized okay, he can't play the role. He couldn't even really stand up, so he couldn't play that role.
Yes. Oh, that
And
must
so-
have been such a blessing to have somebody that you could really trust.
Well, and something that was pretty amazing is he couldn't even open a thing of water. They helped open water, but he got up to cut the cord, and he's like, and we all looked at him like. And he said, Heavenly Father knows that it's the desire of my heart, and he cut it without any issue.
That's beautiful.
Okay,
Thank you.
enough. I can talk for days.
Okay, my name's Tammy Dennis, and I'm just friends with Feline. She invited me, and I'm interested in pelvic floor. Me too. I would like to, stay dry all the time, sleep through the night, and most of all, when we're in the middle of nowhere, like hiking or, that not have to hurry back to the bathroom. Just being able to, I have to go. When we get there, I'll be okay. But so like one of the little kids, I gotta go now.
And it can be actually so disconcerting when you can't go. Like I find I get anxious and it creates stress. for me.
It does,
Yeah.
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 Then all of a sudden you have to go out. Like if there's no water around, all of a sudden you're really thirsty.
Yeah.
It's like all of a sudden when you know that the power's out, that's when you really need the power.
Right.
And then
Right.
yeah, and so then when there's not a bathroom around, then you think about it. Yeah, but just be nice to have more strength there.
So I'm Megan, I'm a doula, and one of the things that I really try to encourage women to do is to get like check and make sure that their pelvic floor is healthy afterwards, because most of the time it's not. And it's just one of those things that they are never talked to about taking care of that pelvic floor after you've had a baby. And
Well, and to be honest, doctors are like, they ignore you on that. They're like, oh, you've had kids. Good luck.
Yeah, they're just, this is where it's at, ladies. And so, yeah, so I've always been just like, I love to just learn more. So I'm excited to learn from you today.
Julie Buck, doula, childbirth educator, dietitian. I'm just here to learn more. I've had 6 children and the last 2 were twins. So I had a lot of weight on my anatomy, which I still have all of it. So I'd like to just make sure I'm up to speed on, and then also, what are some, I'm also a postpartum doula. So afterwards, if there are things I could help my clients do as well.
Thanks. My name's Nikki Andresen, and I'm just a friend of Shar and Feline, and
She's been coming to these circles now for about 3 years.
still feel like I don't know anything. Not because of that, because I'm a slow learner. Yeah, kind of long distance, but yeah. So I just love to learn and be here with you ladies.
I'm Ambria Yoris, and I've been coming to the birth circles and the women's circles for a year and a half, I think. This is my first. She's 7 months old. Her name's Clarity.
Last July, she remember you telling us.
Yep. Yeah, we're
Glad to
very
hear
glad to have them here. So sweet.
So I'm Feline Elias. I organized the class. I'm a direct entry birth worker, and we do circles.
What is that? I've never heard that.
That's what I was
Sorry.
gonna ask.
That means that I have no official training, and I help women have babies. I help them to have their own babies, as opposed to me delivering a baby. I don't deliver babies. The woman delivers the baby, and I just happen to be there to help. It's kind of like being a doula. But a doula would work with somebody supervising the woman, and I work with the woman as her own boss and supervisor.
Pretty leading edge stuff there.
Do we have time for them?
Sure, let's do it. Who's with us?
Charlene.
So
Do
that's
you
a-
want to unmute yourselves and introduce yourselves? Angie, can you hear me?
I will introduce myself. So my
Okay.
name's Stacy. I'm also a doula.
Hi, Stacy.
And yeah, hi. Doula, childbirth educator. But I'm also really interested in pelvic floor just because I've been diagnosed with a bunch of chronic pain conditions, and all the doctors I've seen are just attributing it to the fact I had twins, and that's how it goes. Pelvics hurt. So I'd like to learn some more about that.
Sweet. Well, we're glad you're here.
Thank you.
And who else is here? Angie?
Yeah, it's me. So I'm Angie. I'm a nurse. I've been to several of the classes up there, the birth circles, learning just to be a birth support in the times coming ahead, and definitely interested in pelvic floor and can't find much information. So I'm looking forward to hearing what you have to say.
Great, Angie. Glad you're here.
And I love you guys and miss you.
I miss you so much.
Love you, Angie.
We love you. And I see somebody with a baby. Hi. Is that Sarah? Hi, Sarah. Are you able to speak? I can't hear you.
Can you hear me now?
There you are. I'm so
Click the
happy
button.
you're here, Sarah. So
Yeah.
happy. Congratulations on your baby.
Thank you. Yeah, this is my 6th baby, and so I need help. Yay. No, I'm a midwife in North Carolina, so I'm joining you from the other side of the country, and I'm excited about this. I don't know very much about pelvic floor rehabilitation therapy and stuff, so I and all of the women I work with are looking forward to this a lot. So thanks.
Sweet. Well, we're so happy you're joining us, Sarah. Bless your baby. Okay.
I'll go next. I'm Marla from Manitoba, Canada, and I met Charlene.
Hi, Marla.
Hello.
Hi. Oh my gosh. I'm so happy to see you.
Likewise. So I'm a retired midwife now, but I caught babies from 82 to, I don't know, 8 years ago. I can't do the math. About 30 years. And I just turned 64 and my pelvic floor needs some attention. So I'm happy to be here.
Well, here you're in the right spot.
Right?
Welcome, Marla. You're a veteran. We're happy to have you.
Can I just make one comment? I forget who introduced herself as the birth worker, and I just love changing language for women. So let me just say, nobody delivers babies. Milkmen deliver milk, mailmen deliver mail, men deliver pizza, and women give birth. It's a verb.
It's a verb. We give birth. Praise Jesus. Yes.
Can I take it away?
Okay. Do you want to say something?
Like,
Take the birth back.
can I take away their life? If I give them life, can I take it away? I'm just kidding.
We're so glad you're here, everyone. Is there anybody else that would like to say hello? Oh, Teresa?
Oh, it's Shalee. My first
Shalee.
name.
Hi, Shalee.
Hey.
Hi, Shalee.
Remember from the Ensign Choir?
Oh, of course I do. And you've got another baby now.
Yes. So I'm on here because I've got a new baby, baby number 3. Want to heal myself up, and I've also had a client recently who's been wanting some information on pelvic floor.
Are you massage therapist? I forget, Shalee.
Yes.
Okay. All right. Cool. Well, that's super. Glad you're here, Shalee. It's so good to see you. Is that everybody?
I think this person, and then we got another.
Hi, Mama. Saying hi. Thanks, Feline, for inviting me.
You're welcome.
Thanks for coming.
And then we have Jamie Gallup.
I'll just
Jamie,
say
want to say hi?
Yeah, sorry. My camera's, there's something funny. So I'm just gonna say hi with my black screen. But I'm a doula, and I also do prenatal yoga. I've taught fitness classes for years, and so I've had bits of training with pelvic floor through there, and I just love learning more because there's so many misconceptions out there, and I just appreciate all the info I can get. So thank you for doing this.
We're so glad. Can we just confirm that it's recording?
It says it's recording.
Okay, perfect. I just wanted to make sure.
Get the
Glad you're here. This is quite an interesting group of people that have joined us. How lovely. Like a lot of professionals. That's awesome.
Char, if you could introduce yourself, and then we'll go to Kristi.
I think everybody knows me already.
Nope.
Well, I'm from Canada. I started practicing midwifery as a apprentice trained midwife in 1985. And I practiced for 15 years in non-regulated province. So there was no regulation. It was illegal, so to speak. And then I got my master's degree at the Midwives College of Utah, my associate and my bachelor's and my master's. And then I moved to Seattle and opened a birth center there and practiced there for 7 years. Had a really good time there. I also practiced once I became regulated in Canada. I practiced in the hospitals and at home as a second midwife for 12 years before I moved to Seattle. And then I moved here and been teaching as a impression that I had, very strong impression that I had 7 years ago, was to dedicate my time and my life, close everything down, and just teach people how to help people in the tribulatory days. And I have had visions and dreams and all sorts of stuff. So I just keep doing it no matter what happens. And I've taught probably about 10,000 people now in Canada and the States and in some other countries in the last 7 years. So that's me.
And this is her home.
Yeah.
Thank you.
Thank you, Kristi. And I have pelvic, when you talked about, I could really relate to Cami at that. Like, yes, when I cough, I would really like it that I didn't have to stuff something down there real fast or my bed's gonna get all wet. So don't need to be too blunt here, but hey, I just keep it there all the time.
Well, thank you. It's an honor to be here. My name's Kristi Neibaur. I'm a physical therapist. I got my doctorate a little over 8 years ago. And we did not talk about pelvic floors at all in PT school.
Can I interrupt you for just a second and point out that she said her doctorate, to do what she does, she needed to get a doctorate. It wasn't just a certificate or a little add-on. It was a doctorate.
My student loans prove that. It was a lot, but because we didn't talk about pelvic floors at all, that was continuing educations and continuing certificates to go along with that. And I've done a lot of research on my own as well, studies in the clinic that I'm in, just with the patients that I have, and I'm really passionate about this. I have 6 babies also with a set of twins. And it was while I was pregnant with my second that I had a lot of pain. I was having some incontinence. They told me that was normal. That's what happens when you have babies. And I didn't love that. And so I asked my doctor, well, what can I do? And he tried to send me to a different professional. And I didn't love the idea of that. And so I looked up more natural ways of what could we do? How can I help that's safe for me and my baby? And I found pelvic floor physical therapy, and I went to one who treated me, and I thought, this is miraculous. Everyone needs to know about this. Every woman needs to know that it's not just you've had babies and that's the way it is. And I think there's unfortunately some degree of misunderstanding from having so many males in the OBGYN profession that they're just unaware. I think they're just unaware. And just the increase in knowledge and awareness that has come up within the last decade has just been astounding. So looking at what I do, the physical therapy part of it is really intriguing, and the science behind it, because there's so much that's similar to muscles and bones and nerves as anywhere else in the body. However, it's just a very delicate area, and an area that, especially in our more conservative culture, is just not discussed. And so many of you are in great professions that you do discuss that, and that's not intimidating, but for so many people around here it is. And so getting to talk about peeing, pooping, and sex all day long is fantastic. I just like my kids want to do. And then I go home and do the same thing. New definition of booty call is come wipe my butt. But I love what I do. I'm very passionate, which is why I'm glad to be here and honored to learn from each of you as well. So I want to make this really more interactive. So I'd love feedback, whether it's from Zoom or from all the people here, not only with your experiences, but questions that you have, or anything you want to add would be fantastic. Looking at our population here, and I think it's very similar worldwide at this point, so many women have some degree of anxiety, whether that's diagnosed or not, or however they manage. There's a lot of anxiety. And when I look at my clinic in particular, about 50% of the women who come in have a history of sexual abuse or trauma. So there's a lot of things that are going on before we ever get to the pelvic floor that really affect that. And with so many of those past experiences, the result is tightening or squeezing of the pelvic floor all the time. It's similar to clenching the jaw. It's a coping mechanism that so many of us use. It's a psychosocial manifestation physically with what's going on in the brain. And so the very, very first thing that we work on is what's going on. How can we decrease the adrenaline in our system? How can we decrease the anxiety and get to a place of safety so that we can relax everything? Because that is really the first key to healing the pelvic floor, is being able to fully relax it. And that's a very strong misconception. Once again, I think coming from male providers that have great intentions, they just say, do your Kegels and send you on your way. Which is the opposite of what you're just telling us, right? Yes.
Type more isn't necessarily going to help.
Oh, no. It makes it worse. It makes it worse. So Kegels are fantastic when used appropriately. But not everyone who wants to be able to go hiking should go lift weights heavy. Like, it just doesn't, there's not necessarily a correlation. Yeah. So when I look at the pelvic floor, one, it needs to be healthy. The muscle needs to be healthy. So that involves hydration. We should be drinking half our weight in water half our weight in fluids, with 3/4 of that being non-caffeinated, non-alcoholic, which sometimes is very difficult. So whether you're using Crystal Light or infused water or whatever it is that you use, getting lots and lots of hydration. The second thing is getting really good circulation to the pelvic floor. When it has been clenched for a long period of time, the body diverts blood flow. And so being able to get that back to getting circulation, there are certain techniques that we use, but ultimately women will come back and say, I feel really swollen, because there's actually blood in that area, and the tissue is a little puffier, and that's healthy because then it can be used. It's not in a state of spasticity all the time. So that's the first thing that's super important to work towards. And often the homework that I give women for that is notice if you're clenching and unclench. Just stop. And so many people go, no, I don't think I do that. Okay, well, just notice throughout the next couple of days, and they come back and say, I clench all the time. Like all the time I'm clenching. So stop clenching is the number one thing. Relax that. Second thing is meditation or deep breathing, or whatever that means to you. And I found a couple of podcasts that I like to listen to, just hearing whether it's like hypnobirth type stuff or whatever type of meditation, but to really do that deep belly breathing. And as we belly breathe, are we expanding our pelvic floor as well? That like a balloon, when your belly comes out, when you breathe, your pelvic floor should expand also, and then naturally retract. And that's where we get the healthy range of motion for that pelvic floor. Most of us don't breathe that deeply, which is also what triggers that adrenaline and that anxiety state, is because we're breathing so shallow and in our chest that it stimulates the adrenaline in the fight or flight system for us.
And can I just say that as Kristi's helped me to be able to breathe into my pelvic floor and to relax things and different things like that, I had a really difficult time identifying what those things were. And it was like I had to concentrate so hard the first few times, and it was extremely helpful to have her guide me through that in a very hands-on kind of way, so that I could identify the different muscles and the different areas and to be able to practice that with her. So that was extremely helpful. And it did take a number of nights laying in my bed, kind of biting my tongue like, yeah, I think I've got it. Yeah, okay. Oh, relax. Yeah, I'm relaxed now. It was very odd to try to reprogram a lot of the things that I had been doing. I'm definitely still working on it, but it was so very helpful to have gone into her, even if we had just been able to go in for a couple of times to have her help me identify what was going on.
I love that, and so many of us, it's the same. I remember after my first baby, they told me to go home and do some Kegels, and That was about it. And the first time I went to a pelvic floor physical therapist, she actually put electrodes down by my pelvic floor and said, okay, go ahead and do them. She said, okay, anytime. I said, no, I am. She said, no, you're not. You're squeezing all the wrong muscles and none of the right ones. And so all of us to some degree, I mean, no one puts their hand down there and tells you how to do a Kegel. They just say, go ahead and squeeze your vagina. And we don't always know exactly how to do that. So having someone actually teach
Anybody
you.
else trying right now?
So I'll give you a hint. Don't be squeezing your bum. If you're squeezing your butthole, it's the wrong place. You should be squeezing just anteriorly, just the front part.
Yes, everybody's starting to make this face.
Are you local?
Yes, we are very blessed to have her right here in Roxbury.
So that's the first thing, healthy tissue, and then being able to correctly recruit those muscles or correctly use them in a way that's healthy. Is can we pull up when we need to pull up, and can we let go when we need to let go? Then we work on actual strength with that, but I think most people would be surprised to say, no, you don't need very much strength in your pelvic floor. This is where the challenge of squeezing all the time comes in, is the weight of our organs, especially as we're pregnant, is a lot. And those of us that carry more weight than we would like to in our abdomen, that's a lot more weight pushing down on that pelvic floor. And our abdominals and our glutes should hold 90% of the weight of those organs. And then the pelvic floor just has a little job to do. So if we're correctly recruiting the right muscles, it doesn't have to be super strong. So really, I hate vaginal weights. I think they're awful.
How interesting.
So many people think they need to put it up and walk around, and that's really not the purpose of how to use them anyway. But it's this idea of we don't need that much strength. We need our abdominals to help take the weight of our organs so that it can do its job correctly. So we work on that a lot, is how to recruit the abdominals and not the pelvic floor. Each of you can try that, but most of the time people contract both together, squeeze everything up and in. So can we tighten our tummies in, not Valsalva pushing out like you're trying to poop, right? But tighten up and in, and then relax that pelvic floor. And that's a better posture for us all the time. Yes, there's so much coordination, right? And the best way is either come see me and I'll tell you, or literally put your hand there. Or if you're in the shower, put your finger up there and feel what's happening to my pelvic floor as I'm doing all this, so that you can feel. And it's not too hard to feel once you get in the right spot, but to know, okay, am I pushing down when I think I'm pushing out? Am I squeezing up? And what areas am I squeezing? Am I using my glutes or my thighs? And being able to identify what parts are being used. And that really takes us to the last part, is that coordination of when do I contract which things, and which activities do I contract which things. And the goal is that we shouldn't have to think about our pelvic floors. We shouldn't have to cross our legs when we know a sneeze is coming. And so how do we get to where it's doing all the things it needs to on its own, so that we don't need bladder surgery, so that we don't need whatever else. Side note, physical therapy actually has better recover rates.
I asked, there was no physical therapist in the area. And it was so bad. Like, I'm talking, when I turned 40, I was in defense. At 40, I was sitting on the floor like this with me because of the push backward. Standing up from a sitting position like this would make me. And mind you, I was also dating the boyfriend that I'm with at that exact same time.
And he's still with you though, so hey.
And he was so sweet to say, babe, they're so sexy on you. That's fantastic. And I'm like, yeah, my dependents are so sexy. I mean, there's nothing wrong with being independent, I guess, you know, whatever, but I was hoping that I would be more like in my 60s or maybe 70s, right? Or never. Yeah. But in my 40s, literally 39, 40, it was my first baby that did that to me. And I did have 6, and it was my first that, you know, just completely.
That breaks my heart.
I have, and it wasn't just bladder. I don't poop normally. I haven't. My whole, since 20s, 30s, when I got my surgery, I cried the first time I pooped because I was like, is this how everybody poops? Like, it comes out like this normally?
I don't have to put myself in a weird position, push my hand up into my vagina and push the poop out. That's not normal for everyone to have to do that. I thought that was normal, right? I mean, I knew it was.
I think that the problem is that we, in our society, we've created the shame around it. But if you notice, all of us are here.
Right.
Like it's more common, but we kind of laugh about it. We're all like, oh, don't jump on a trampoline, you know, like.
Yeah, well, I was past that point in my 20s, like a cough, sneeze, jumping my trampoline. By my 30s, now I'm just walking and peeing. Like
I'm in my 30s, that's where I'm at.
Right, you know, when you're like, I want to go hiking and like I need to go to the bathroom, and I'm sitting there thinking to myself, I would have just like stepped aside and kept hiking because I can't, you know, like there's no getting, or I just pee down my legs and whatever, that is what it is. Pack a lot of pants and underwear. I mean, you know, like and then I was like, okay, I'll just go to the pits because I'm to the point where changing 5 times a day. And as a massage therapist, I'm constantly washing myself because nobody wants a smelling vagina right over them as I'm massaging it, right? You know, like I'm washing myself constantly. It's not fun. So I was like, okay, I'll go with the surgery. But I was trying, the closest what I had found was in Salt Lake. I'm like, I don't have the money and the means to get to Salt Lake. But I was prolapsing vaginally, bladder, and rectally, all coming out of me. I'm so sorry. I know, it sucks. And I am almost 3 years post-surgery, and I'm leaking already. I'm having issues pooping.
Are you local?
I know.
So when you say you wish you hadn't done it,
Well, it's not what they say it is, right? The doctors, I'm like, okay, first of all, it's not to get whatever, but I was in the best sex life of my life. I had trauma as a child. And then my marriage was really flat sexually. And then I was very promiscuous because I was like, I'm going to own my own sexuality now. So if I want an orgasm, I'm going to go get it. Right. So then I went and discovered my own sexuality. So then I get into this relationship that it's amazing. I'm feeling fulfilled. It's healthy. It's an amazing sex life. 9 months into that, I have my surgery. And sex is completely different. Flipped completely different, right? Like I don't orgasm. It's completely different. We're going from like 15 in a night to none, or maybe 1, with a lot of effort.
It created lots of other problems.
Right. So, and it doesn't even solve it really. And I'm thinking, why don't we talk about this more? Why don't we talk about the fact that like, and the doctor said, will this affect my sex life? Will it affect this? No, you'll be fine. You're keeping your ovaries. Like, you don't know. You're a stupid man.
I have been heard to say no uterus, no opinion.
Anyway, like my friend's going to the same doctor and he's going to get a hysterectomy. And she's like, well, my friend said it ruined it. She's lying to you. Those are exactly the words he said to my friend. She's lying to you. And I'm like, really? As I cried to my friend, I'm lying to him. No, that's not true. So yes, I want to know and then also speak to others. Like, go see Kristi. or whatever I can do as a massage therapist. I know I'm limited. I have researched and I am limited. You're not allowed it, certain. Right, you're not even really allowed externally in the area. You're really only, certain areas. And I'm like, then fine, I'll go do the other trainings, whatever, but I don't have time in my life. Be a doctor. Anyway. Yeah, that's great. Great. Other thoughts? There's my story. Thanks for sharing.
I would wager that that's so many of our stories, but that's what I hear a lot is, oh, well, I'm in my 40s now. I just don't orgasm anymore. Sex just isn't that great. I'm past menopause. It just shouldn't be. And that's not the
I
case.
thought that sex was supposed to be the best of your life in your 40s.
It was. I'm telling you what, I was like,
I need to get me a man then.
Okay, close. It was. I learned how to eat it, and so to have that flip completely, but at the same time, I'm peeing so bad, right? So half the time
It could be both.
Sure. Matter. We're in the moment. We're enjoying it. It's the best selfie.
Whichever it is. In the shower. Problem solved.
Water is not that great of a.
No, it's not.
No, but you can't tell because it just washes
Yeah.
down. That's what I'm saying.
Yeah. You just might need to bring lube into the shower.
Yeah.
I was just saying because the heat doesn't matter because it all washes away.
Yeah, it's okay. When you get your bed wet, be proud of it. That's fine.
Mine is probably because my 4-year-old. I'm not kidding.
But that is something else I suggested. Don't be afraid to use lube, but don't use anything that's tingling, warming, or flavored. They just don't feel nice. Find something that's water-based or mineral oil-based that's going to be nice. When it comes to, well, if we look at pregnancy, some of the things that we work on during pregnancy is really that ability to squeeze up versus push down. And so many women think they're pushing down and they're really squeezing up. And that's the cause of so much tearing. So those of you who are midwives or doulas, if when we say to push, they are squeezing up because they don't know the difference. They don't know how to recruit those muscles. And so they're squeezing up as their contractions pushing down, and that results in tearing. So being able to correctly release those muscles and open them while the contraction's pushing down that way is super, super helpful. And then of course, as many of you are aware, the perineal stretching to help with the tearing. Postpartum, we work on a lot of scar massage, scar mobilizations for those that have any scarring. They are most often the cause of pain with sex, pain, even wearing jeans sometimes can rub those. Sometimes they're clear internal, sometimes they're external, sometimes they go all the way to the anus, but those tears cause pain.
Can I ask
And
a question
scar
about
tissue
that?
develops.
When you do an assessment, like an initial assessment, do you go in and then you can make up a plan for, and then is part of that plan, massage, is part of that plan actually massaging that tissue out? Okay.
A large part.
And, okay. How painful, like, can you just give us an idea?
Yeah, on a scale of 0 to 10, we really don't want the pain getting above a 3. So it's gonna be some discomfort. You're gonna feel that it's there and like, this feels yucky, but it shouldn't be. As soon as anyone's clenching or tensing up, I'm done.
Okay.
We don't. That creates
You're not
other pain
torturing
pathways.
Yeah, although, you know, sometimes when they work inside your mouth, you know, if you've got like a really tight jaw, which I don't know if you found this in your research, you probably have, is that the jaw is really connected to the vagina and the vulva, right? But these muscles can be really, really tight in here too. And I feel like that's a definite connection.
The jaw absolutely is correlated with the pelvic floor from the vagus nerve.
From the vagus nerve. Okay, that's how it's all
because it
connected
integrates
to the
both of
stomach.
them.
Yeah, okay. Okay.
Which is also why when people are nervous or scared, that it contracts.
Okay. And why we get stomach aches and all kinds of stuff too.
Well, so some of that is the pelvic floor muscles. If you think about knots in your neck that can give you a headache, we hear about that a lot. Same thing with the pelvic floor. You can get knots in those muscles from constantly clenching that refer pain to the abdomen, to the hips, to the low back, down the legs.
I'm coming to you. That's all.
But so many people say, and I see even teenage girls for this, I have horrendous periods and they think I might have endometriosis, which can only be diagnosed surgically. And they want to put me on birth control, but I'm 16 and I don't want to go on birth control. And we find out they're clenching and they've created trigger points. I had one girl that came, she had been going to Primary Children's Hospital for gastroenterology because she was having horrible abdominal pain. Come to find out, it's all referred pain from the pelvic floor. They had her on 4 different laxatives. She's like, it doesn't really help. I still have pain all the time.
I feel like this is way more common than we think.
Oh yeah. Oh yeah.
Super common, right? We're just not knowledgeable about our pelvic floor.
Well, and we don't realize the effects of it, how much it can affect. One of the things I'm trying to do is educate other physical therapists or other practitioners that are working on those things to say, absolutely, if someone has low back pain, treat their low back pain. And if it's not getting better like you think it should, it's probably not their low back. Send them to me. So go ahead and treat them first. And if it doesn't work, because everyone wants a chance to not have to get undressed first. But most often in women, it's all connected. That's all connected.
How is your jaw connected with that? Your pelvic floor?
The vagus nerve comes out of C1, C2 and innervates those muscles, also travels down and innervates the pelvic floor. So when one of them is tight or causing dysfunction, causing problems, it'll go back up to that nerve root, and then anything that nerve root innervates will also have effects, which is why when you have back pain, you can feel it all the way in your foot.
And why during labor, we really focus on having women relax their mouths and their jaws, moan, and do things that help this part relax it, and it has a direct effect on the vagina.
A big clencher.
Yeah.
I don't know.
Yeah.
So there's about a 99.9% probability that your pelvic floor is also that tight. But I would say that's most of us. 99% of the people who come into my clinic, there's probably one in 25, it's really, really low percentages that are too loose, that are leaking because they're just not strong enough.
I'm probably the only one not having sex right now. But how does sex like affect that? So you're like.
That's what I was wondering.
No, so yeah, great question. No, I've had people ask that all the time. If I don't want to be looser, because does that make me loose? It really has no effect. And especially if you have the volitional capacity to tighten when you want to, then you can actually make it better as compared to not having that.
Being super tight.
But being tight with the muscles doesn't mean tight squeezing the vagina. It means tight between sides of the pelvis, between the vagina and the sides. And so really it's just causing pain hitting anywhere on the sides. That makes sense.
So I guess, yeah, I guess I want to understand more of the anatomy of I guess I don't know as much about the pelvic floor then. Because I'm like, okay, so how's this affecting the bladder? How's this affecting the vagina? How is this affecting the anus? Like, yeah.
So there are muscles that fully sphincter the urethra and the anus. But very often when the pelvic floor is too tight, it pinches those and irritates them. One, it becomes very difficult to have a bowel movement because you're pushing against that tight sphincter.
Okay.
With the urethra, sometimes people have a hard time initiating peeing, but very often they feel like they have to pee all the time.
My friends and I were just talking about this.
Because it's irritated, because the urethra is getting stimulated and getting irritated, makes you feel like you need to pee and then you get a dribble. And it's super frustrating.
It's like a UTI, but not really.
It can give you UTI-like symptoms. No, it gives you UTI-like symptoms. So we're trying to create awareness to docs to say when someone comes in with UTI symptoms and it tests negative and they say, well, let's just give you antibiotics anyway.
Right.
That's not, if it tests negative, then it's probably not a bacterial infection. It's probably a muscular irritation.
But the symptoms are mimicking it.
Absolutely.
I have had that exact same thing. Exactly.
And I don't know how many, I've done it where I took 5 antibiotics in a 12-month period, which destroys your gut, which destroys everything else, and didn't get rid of my UTI. Well,
okay, thank you. So for me, I'm just thinking about, like, for me, I was like, okay, if you're already tight and you're having sex and you're tightening, does that, like, I don't know.
What do you mean by tightening?
Like
trying to squeeze during sex?
No. Like, is that gonna, like, because you talked about like anxiety, and if people have trauma, they're probably gonna get tenser. Is that gonna affect?
It's gonna affect sex for sure.
Well,
because when you have a
you
tight
can be
muscle,
really blunt.
Oh, girl, I don't have that issue. I'm trying to think of how to word it. I'm like, if you're so tense, is that during sex? Is that gonna negative? Like, that's a negative. And it's going to make it worse. Okay.
Sex will make it worse.
No, yeah, that's what
what you're saying.
Yeah.
It depends. It depends on if sex is traumatic. If there are a lot of women that don't want to have sex because they know it's going to hurt, and then they tighten even more upon entry because they're afraid it's going to hurt. So then they continue to tighten throughout. Some women are able to relax during sex because they're relaxing to the sensation, and that's better for them. So it depends on their reaction. That was a it depends answer.
So how can pelvic floor work help with someone who's having a difficult time orgasming?
Great question. So
That is a
one,
good
learning,
question.
Yeah.
Very
learning
What is
how to-
orgasm? Because I never actually had one during sex.
So partially learning to let go will help to increase sensation rather than being so tight. When we're so tight, it limits blood flow, it limits sensation as well. Being so tight can actually pinch nerves that are innervating the vulva so that there is lack of sensation. There's lack of sensation, decreased sensation to the clitoris, being so tight. When it is too loose, it can hood the clitoris even more, making it harder to get to stimulate. When it's loose, then we not having enough strength doesn't put the vagina at an optimal angle to be able to be stimulated in the spots that it needs to be.
Okay, can I ask a question? Just from your experience that you've had with your own clientele, do you find that if you're working with somebody who's having these issues and you're going in there and you're helping them relax, you're helping them identify that ability to differentiate those muscles of the, you know, the front and the back so that they're actually relaxing and using more of their
core.
Yeah. What do you find is the result with those, with the women who have had the physical therapy with you? What are the differences that they're experiencing in their sex life and things like that? What is your?
Oh, it's absolutely more positive. I've had so many women come cry to me and say, I had an orgasm for the first time in 12 years.
So it's really like, I think it goes hand in hand with them taking the action for themselves, but then also they need to come in and get that help with getting muscles worked up.
Yeah, and really what I provide is often just education and empowerment to say, now go home and you can do this. Now go home and explore with your partner what that feels like and explore where your new areas are once everything's different. Different postpartum, different post-surgery, different post-menopause. What actually feels good at this point, because it's very different.
With every birth, I felt like I have a whole new body. that I need to get to know.
How many babies have you?
I've had 8 children.
8 children.
What other questions, comments,
Have you seen
concerns?
that intensity or whatever? It's supposed to help with pelvic floor. I'm just wondering if that's, do you know what I'm talking about?
Is it that thing you put inside and then
Yeah.
it's a TENS unit, but it's internal? I haven't.
Yes, there are many different brands, and there are some that I use. I probably use one on every 50 patients. And the only times that I do use it is when someone has a complete inability to find those muscles or contract them. Complete inability. If they have even some ability to find them, there's really no need for it. It's like putting those belts that jiggle your belly on. It's not actually strengthening anything. So it's not actually helpful unless they completely cannot find those muscles.
Just helping them
Yeah.
identify those muscles.
Yes.
Yeah, but those could also really improve blood flow, which you said was a positive thing, couldn't it?
Yes, they're much easier, cheaper, and more comfortable ways to do
Okay.
that.
And more comfortable than
So
Not quite that
what are
intense.
some things we can do at home, like by ourselves, to help with the strength of our? I mean, I know you mentioned
Don't do
hydration,
Kegels.
but yeah, not Kegels, not Kegels. So what is there exercises?
Yeah.
Okay.
Yeah.
Okay.
So the first thing is being able to relax it and being able to contract that. And you're only going to be able to find that by probably putting your finger up there and figuring out, are we relaxing? Are we contracting?
And you're just feeling to see if there's tightening around your finger or loosening.
And the loosening sometimes will just feel like loosening. Sometimes you'll actually get, like I have a bladder prolapse. My bladder will push down onto it.
Oh, okay.
And I know that. I figured out what it feels like, and it's not that big of a deal, but you can sometimes feel almost like it's pushing out type of idea.
And that's correct then. Then
For bearing down.
For bearing
Now,
down,
for
yeah.
someone who has a prolapse, like myself, bearing down strongly is not going to be recommended because I don't want to keep pushing my bladder out of my vagina. So just bearing down slightly enough to relax those muscles is helpful. So anytime you catch yourself clenching, I'm a clencher, I have anxiety, I have a history of sexual trauma, I have all those indicators, is every time I catch myself clenching, I bear down slightly and get my muscles to relax. And I probably do that 15 times a day. But being aware and being able to catch that helps. Yeah.
Okay, so as I'm practicing, I feel like I have to pee though. Is that normal? Okay. I
It's giving you that
see my pants
sensation.
already.
Here's the next
I'm
part
like,
is that the
yeah, because I
pelvic
feel like
floor. Yeah, no, that's okay. The pelvic floor and the bladder have an opposite relationship. And then these are my bladder, pelvic floor. As the bladder contracts, the pelvic floor has to relax for urine to exit. And because we've been peeing since we were born, that is a relationship that we're used to. So anytime your pelvic floor is relaxing, your bladder thinks, oh, it's time. So it's starting to give you a little contraction to say, oh, we're ready. Not. So one, it'll get used to it. It'll get used to it if you don't give in. So we call it jicking, just in casing. The idea of I'm going to the grocery store, I better pee before I go because I don't have to pee while I'm at the store. Just in casing is letting your bladder train you. It's like a 2-year-old that you get into and give into and give into, and pretty much you're not in control anymore. And so what we do is when you have the urge to go, just the opposite. When your bladder starts to tell you, and if you know, I just peed 20 minutes ago, if you do several quick contractions, several quick Kegels, like 6 to 10 of them is what the research shows, 6 to 10 Kegels, it will make the bladder relax.
That's good to know.
If that is a true urge, if you truly have to go, it will come back in about a minute, but it will be a gradual comeback. It'll gradually come back until it's convenient, until it's a convenient time to pee. If you get a sudden, like, I just turned on the water to wash the dishes and, oh my gosh, I got to go right now and I'm not going to make it to the bathroom. That's not a real urge. That is your bladder just deciding to contract. So contract the pelvic floor, make the bladder relax, and make it reset itself.
You gotta train those puppies.
But it really is. It's like the philosophy of Pavlov's dog, you know, that they rang the bell and then they fed him, rang the bell, then they fed him. And eventually when they rang the bell, the dogs their mouths started watering. And if we go to the bathroom every time we walk in the door, or go to the bathroom every time we start doing dishes, now we've trained our bladder. Every time I walk in the door, it starts to contract, whether or not I actually have to go.
And there's also, I'm on a pelvic floor health site on Facebook called Womanhood, which I really highly recommend. She's from Australia. She's a midwife. She's amazing. But one of the things she says is that it's really important to let your bladder actually have the weight of a full, to have a full bladder when it goes. You're not like forcing your urine out. You're just, maybe the initial, you have to do a little push, and then you're just relaxing as you're peeing. You're not continuing to push.
So we shouldn't stop our pee like they
No,
tell you all the
Not
time.
good for you.
No, what I'm saying is that bearing down feeling, we call them power peers. Nurses and teachers are the worst because they only have this long to pee. Is that we push and push and push to pee as fast as we can to get out of there. And like you said,
It's
we
not good
shouldn't.
for you.
And we shouldn't do
Yeah.
that with bowel movements either. And someone who's had splint, who's had to actually push and redirect poop, some has realized that problem as well. But we shouldn't push. We should just relax and let everything naturally do its thing.
Even if you have to push just a little bit initially to get it to start, but then to train yourself not to continue pushing and to let your body just do it. Because and if you're always going to pee on an empty or partially empty bladder, your bladder's not really getting the cycle it needs. It needs to be filled and empty, filled and empty. That's what it needs to function well.
So what if you dribble at the end of going pee? So I pee just great, but then I find myself sitting on the potty for quite a while while the last bits are dribbling out.
Sometimes you can lift
dribbling
yourself
out.
like this. If you lift
Dribbling
yourself
out.
up, sometimes your bladder's literally prolapse forward. If you go like that, you'll find you get a whole bunch more coming out.
And same thing posteriorly, is it?
You
can
can do
often-
it, right?
Yep, so
Yeah.
just wiggle around, do some jiggles.
I do lots of wiggling before I get up because I won't be done because I'm not coming back to that bathroom for a long time.
So the next question that people usually ask is, well, how much should I be peeing? How do I know if it's normal? Well, this is a little bit, it's not super accurate, but the idea of if you can count 1,001, 1,002, 1,003, that's about an ounce every time, if you're, depending on the flow of your stream. Our bladder maxes out at about 20, and we should be filling it 2/3 to 3/4 on a normal
Cycle.
I might have an extra large bladder.
But someone who's, and that can be, but someone who's peeing a lot, we're probably maxing the bladder out every time, and it's like your credit card, it's not good to max it out every time.
Dang, I'm screwed.
I'm like, kid bucking the crap out of me. When do I have time to go pee?
So when you say it should, most bladders hold about 20 ounces, you're talking about. So that would be like 60 seconds. Oh, no, because we're only 2/3. Yeah.
So you should be able to count to 1,001 to 12 to 15 is a normal
12 to
amount.
15 about would be, then you could say, okay, my bladder is relatively full, or
Yes.
about where it should
Yes,
be.
that's appropriate.
Because when you go too full or when you push, that causes reflux, doesn't it? Which can cause UTIs. Like when you're pushing, you're like, you've got a full bladder, you're pushing against, like if you're doing the nurse and teacher thing, you're pushing against it. Then when those muscles go back to being able to pull your pants on, sometimes there can be some slosh up into the kidney area. Is that right? Or is that like reflux?
I haven't read that.
Okay. Okay. It's like a reflex of the stomach, but it's a reflex of urine. And I understood that can cause UTIs and even kidney infections.
Interesting.
I think there would probably need to be like a perfect storm.
Maybe so. Okay.
For that to happen.
Okay.
Sure, if that's enough to scare you not to push, then.
Okay. So that's not the reason you're saying not to push. The reason you're saying not to push is just because you want to relax that. You want that to happen naturally.
Yeah, and when we're pushing, that bladder against the pelvic floor, it's more strain on the pelvic floor. It's like having a baby.
Okay.
I think relaxation is part of it too, right? Right, just like allowing. So you're not kind
So put the meditation on and then go
of. Yeah.
Just meditate while you're on the body.
Yes. I just want to make a little comment about something that I've discovered that I really like, and I think it's really powerful for the pelvic floor in general, and that is vaginal herbal steams. And I do them frequently. I really enjoy it. I found the study show it helps with everything, absolutely everything.
I have to put my plug in for vaginal steaming. I experienced polymenorrhea for 8 years, and I did all sorts of like herbs and things orally to try to lengthen my cycles because I was going crazy because I was bleeding all the time and a lot. And I found Kelly Garza, and she has like a bunch of vaginal steaming education courses and stuff.
Cool.
And I took her vaginal steaming facilitator course, and I started doing it, and it was just within one cycle. So I had an 18-day cycle, which my average for those 8 years was 20 days. And I was crazy all the time. And it's like, well, you would be too if you were bleeding all the time. Yeah. And then I just steamed like 4 times. And within the next cycle, I had a 28-day cycle. And I've had long cycles. I've had normal cycles ever since. So I know that's like tangent, but yoni steaming is one.
That's miraculous, Ruth. Thank you for sharing. I am really impressed with the vaginal steams. I think they're like psychologically, like you talked about the connection with the emotional trauma and the tightness that seems to be part of that, right? And I feel like the vaginal steams are so nurturing. They're really self-nurturing and healing.
Is there anyone locally that's doing it?
What a great
Well, I
question.
do it. I can teach you how to do it. I make I have a gift for you. We're going to give you a vaginal steam from my friend who makes them. They're beautiful.
So,
I can help you with that.
Shar, some people have never heard of a vaginal steam. Can you?
I can demonstrate.
Well, we might as well just do the whole pelvic floor class. I'm not gonna demonstrate.
Vaginal herbal steams are used all over the world, and they've been used anciently as well. And in countries like Japan, you go in, and it's like a spa. You go in and everybody's doing it. You know? I mean, they have these little cubicles or whatever. But it's amazing how powerful the vaginal steam is. Okay, so you have a bunch of herbs. I have a whole bunch of packages of them because my friend makes them for me because I just love them, and I give them away and use them myself. I want to talk to you more about this, of course. But what I do is you do it as a ritual. So I do anyway. I find that to do it as a ritual. So you set aside a time, make sure you have privacy. You put on some kind of nice music, relaxing music. I usually like candles. So there's kind of a holistic feeling to it. It takes about maybe at the most 45 minutes, to do one, sometimes longer. And then you can put a stainless steel bowl right inside your toilet. This is the easiest way to do it. Put it right inside your toilet. Put about a cup of your herbs in there. Boil your water. I usually use my distilled water, but you can just use regular water too. And then you just fill your bowl up, put the lid down, put a cloth over it, let it sit there for, maybe 5-10 minutes while it steeps. And then you undress and you have like a nice warm towel and a nice warm blanket. You sit down and you got, nice low lighting, your music's on. You wrap yourself in the towels, and you wrap yourself in, I usually use a wool blanket on the outside. And then I just have a rest for my feet, and I just have a pillow behind me. And I either meditate, I pray, I whatever, sing. And then I actually connect with, this is something I started doing after the first couple times because I was really trying to enhance the experience. And I actually connected to the herbs. I know this might sound strange, but I literally prayed and I connected to Mother Earth and the herbs, and I just prayed that the essence of those herbs would do what they were meant to do. And I could literally feel, as soon as I did that psychological, spiritual, thing, I could literally feel all of my tissues just like absorbing, and I could start smelling the herbs. It was like the herbs were, I could literally taste those herbs. So it's like, that is one of the most absorbent places. And there's all kinds of research now on endometriosis, polyps, all kinds of stuff being healed, and especially sexual trauma. I've had the sexual trauma. Who hasn't, right? Just about everybody, right? So, we all have a lot of healing to do sexually, and that is where it can be. So it's a physical and an emotional healing, I believe, and spiritual too. Anyway.
I love it.
Yeah.
That should have been 2 months ago.
Well, keep coming.
Well, I had a hysterectomy 2 months ago.
I still have a womb space. Your womb space is still there. So
because I was having bleeding issues like her and clots the size of my head. So.
Oh my goodness. And you go to the doctors and they give us
Well, and I tried to research a little bit.
Yeah.
I tried to research it, and they were like, everything I read was the only cure for this is a hysterectomy.
Our internet is kind of limited now. You
Well,
can't
I
find the
asked you
same
to.
things that were on it. So yeah, it's difficult, and there aren't guarantees. It's not like I can say, oh yeah, you do this. Wow, you can do things, but it'll take a few months, and by the time it's like, so things are difficult.
And I believe that when you come to see me, my answer is physical therapy will fix it. When you go to see a midwife, their answer is that herbal vaginal steams will fix it. When you go to see a surgeon.
No, I recommend physical therapists.
Well, but just that if you go to see a surgeon, all they know how to do to fix you is either to give you a medication or surgery. And it's not that they are not supportive of other things.
I will say that.
Yeah.
It wasn't just about
No, and that's okay. But depending on who you go to, their answer is whatever they can provide, usually, or what their experience is with. Just like someone who has had only hospital births has an opinion about that as compared to a home birth. And it's just based on your experiences, and that's okay. Just take that into consideration.
I think it's nice to have something that you can do on your own, so you feel really independent. Like, I think, knowing how to move your body. I think too much sitting isn't good, especially on chairs, because we're just sitting on that, right? Well, how is that going to help the circulation? But I think also having a combination of physical therapy and your own, and something that you could do independently. I just thought Ruth might read out these herbs just so that I could tell what's in them.
So this blend has motherwort, mugwort, comfrey, yarrow leaf and flower, rosemary, lavender, calendula, and red rose.
And I gather a lot of these on my own, a lot of these herbs, like my red rose, I have a lot of those. So I mean, what I do is I'll get one of these and then I'll add a bunch of my own stuff in there so you can see.
I'm gonna steal some.
She has comprehension. Oh yeah. This is my friend. I helped her with 2 babies in Seattle. She makes it.
So what's like maybe 2 exercises that you can do at home?
Relax.
And maybe you could go over healthy posture.
Healthy posture. That's what I was thinking. Like our way that we move our bodies is important.
Yeah, the first thing I want to do is I'm actually going to turn on a meditation because this is a really good one that I like. And I think it's really explains well how to belly breathe and what all that means, how we use our diaphragm and our pelvic floor in synergy. When our diaphragm, when we breathe in and our diaphragm flattens, that our pelvic floor expands downward and vice versa. If that's okay.
Yes.
We'll only do about 2 minutes.
As loud as you can. So
What I'd like you to do next is put your hands on your belly. For many of us, we are afraid to release our belly muscles. For the next couple of minutes, I'd like you to do your best to fight that fear of letting your gut hang out. With your hands on your belly, I'd like you to take a breath in and imagine your belly getting round like you have a baby inside of it, for lack of any better way of saying it. So you want to breathe in, down into that belly and really relax the muscles. If this is difficult for you, don't worry. That's actually really normal for most people. On the exhale, what I'd like you to do, and you can use your hands to help you, I'd like you to imagine that you're like Bruce Lee and you're doing a kia. On that exhale, I'd like you to suck your belly button as far back as you possibly can, kind of caving out your belly. And again, standing up can be very helpful to get the feeling of this. So exhaling and maybe even doing a kia. Now breathe in again and relax those muscles in the belly and get that air down there. And exhale. Do that kia, concaving that belly. Breathe in again. Now, after a couple of these breaths, you may notice a feeling that's just below your rib cage, as though something is kind of stretching there. That's your diaphragm. Often we're walking around without doing any breathing that engages our diaphragm. Not good. Stretching it means it's working. Do a couple more of these extreme breaths, and then we're going to take it to a slightly more natural state. So breathe in, make your belly very round, and exhale, making it concave, drawing that belly button all the way back to the spine. Breathing in again, relaxing it, maybe even feeling that stretch of the diaphragm muscle just below the rib cage. And now for the next couple of breaths, just allow the breath to become a little more natural. There's no need now to do the kia, the concaving, or really forcing the belly to be round. But notice that stretching still happening as you breathe into that soft belly. And exhaling. And I'm going to be quiet for a minute or so while you just continue to practice your ability to breathe in this way.
Oh, that was fantastic. And if you could send me the link and I'll
Oh,
make sure
yeah,
that
we'll put it on the
gets the
Facebook page. Oh, I think I need to put it.
What's your?
That's
The
so
event.
good.
I'll be sure to send.
Yeah, we'll put it on Facebook.
You were invited.
Oh, then yes, I am. She private message.
That was wonderful.
That would be the number one thing. Belly breathing throughout the day, getting that pelvic floor to lengthen and then shorten as you breathe with breath is super important. Second thing would be those quick flicks, just to buy yourself time, those 6 to 10 quick contractions when you get that sudden powerful urge to pee. Is to stay still wherever you're at, do those 6 to 10 contractions, wait about 3 to 5 seconds and allow that urge to dissipate. And time to walk to the bathroom.
So what's quick to you?
As fast as you can contract and relax. So for some people, it's about that fast. Not with your hands. I had someone actually do it with their hands. But with your pelvic floor, if you can do it faster, great, but still learning to recruit your pelvic floor, often it's not that fast. And then the last thing would be a little bit of abdominal recruitment. So this one's easy. So yeah, can you
Sure,
spread
that's
out a
all
little bit?
Yeah, we've got room to do it for sure.
Lay down with your knees up, lie down. Knees cracked down. Oh, except for those in skirts. You can be sideline if you'd like.
I'll watch.
Nobody's gonna look up your skirt.
Oh, I would look up your stuff. Just kidding.
We practice in lying down because it is the anti-gravity. It's the easiest position to get this
Just
right.
a sleepover.
Yes.
Somebody
All
take
right.
a picture of this.
So as you're lying down, I want you to great all the time.
Get the perfect cleavage.
This is our class picture right now. Everybody smile.
Smile with your knees. Smile. Now there is someone looking up your skirt. Okay, so I want you to practice tilting your pelvis. It almost seems like a bedroom move, but this idea of arching your back up and then rotating it back. Yes, it is cat-cow when you're in hands and knees.
I was doing this earlier today.
So this is a great way to initially get your pelvis moving and to get some of those deep pelvic floor muscles activated.
But don't use your butt? Or can,
Yeah,
I can never use my butt. Okay.
Well,
It's all here. This is so helpful when the.
so like not,
using your
so go
glutes
ahead
so
and
much
leave
to-
your hips down and now just, yeah, there you go.
Oh,
So
maybe
your
that's
butt's not
where I-
fully off the ground.
So it's like we're
Okay,
rolling
now
in.
find neutral. Somewhere in between those where your abdomen is partially contracted and you're gonna suck that belly button up and in towards your spine. Have a nice contraction across your tummy. If you need to feel, I usually feel just inside your hip bones is a great place to feel if it's tight. Especially those of us with a pooch, that you can kind of get to the side of it, right to the side of those front pelvis bones. Okay, now from this position, hold this while you breathe. There's still a level of contraction that's there. This is the postural position that your pelvis should be in most all the time. When you're standing, when you're sitting, keep that pelvis directly below your rib cage. Now, once you're there, let's try to do a little bit of marching with your feet and keep your tummy tight. It's a great way to simulate walking if you were in a standing position.
Okay, so this marching.
Yeah.
I'm like, ooh.
And you can do other variations with your legs. You can straighten the leg out, level with the ground.
like a 6 inches type thing. You can do a single leg clamshell. And just realizing when you get to the edges of your capabilities, you will lose that contraction. So really working those abdominals. Great question. Dropping one knee out.
Okay.
Just one at a time. It's easier to do too.
I could do it in unison left.
Yeah.
Like the can
So now maintain that abdominal contraction. Let's make sure your pelvic floor is relaxed.
That's the hard one.
Wait. I don't even know how to do that. So your tummy should be tight. Now do a slight bear down. Slightly push down and out.
I don't feel like I can do both at the same time.
It takes so much practice. And you will probably need to have your hand down there. And even if you don't want to put it actually in, just putting your hand on your perineum, you can often feel as you bear down, the muscles press downward into your hand versus.
Apparently I never bear down.
So what? She's a professional. She can feel it. I'm all like, Jello.
For me personally, I felt that when I would bear down a little, it helped me to then get to that relaxed state. It was like I'm clenching, so I bear down a little, and then I'll kind of come back from that, and that helped me find my relaxed state.
I feel like if I'm letting go, I'm pushing my belly out.
Yeah, I do the same thing.
I'm like, so that's very common initially, is that so many people push their belly out to push it down, and we shouldn't need to do that.
So I need to try to have my belly button back while I'm bearing down.
Yes.
This is not
Exactly. That's why I really liked Kristi's help when I was trying to identify these things. Can I borrow?
Oh my God.
I'm getting naked tonight.
Okay.
That's all I know.
I feel like I really
Let's
need
translate
to
that to a
really
sitting position.
feel
As you're sitting, we can use teenagers as a perfect example for us. We have teenage boy that completely rotates their pelvis back too far. And we have teenage girl who sits up with her booty out. So can we find somewhere in the middle that's a better posture for us? And this is how we should sit rather than like this at the computer all day versus, oh, I'm sitting up and I'm putting my shoulders back and really my back is just arched. Back is arched, not too healthy. Finding that neutral position,
You
just
can
like
tuck.
you did on the floor, but not all the way to here.
Right.
So while you're sitting and then also while you're standing, how many of you have gotten your belly wet doing dishes? Because what do? We lean up against the counter because
We need support.
So instead, rotating that pelvis back just enough, tucking that butt under so that our tummy is tight, not 100% tight, like 20 to 50% tight. While probably the same way you actually do at the stove because you don't want to burn your belly versus doing dishes.
Right. No, I don't know how to work it.
So once you feel like you get it on the floor, try it in a chair and then try it in standing. Try finding that pelvic neutral, holding that.
The best
While you do some hard
ladies.
shapes. Hold that.
We got some
stuff in chat.
Could you talk a little about prolapse? How does learning to relax the pelvic floor affect a uterine prolapse?
Oh, great question.
Or I can't pronounce that.
Rectocele?
Yeah.
Uh-huh.
And cytocele.
Cystocele.
Okay, whatever.
So cystocele is the bladder pressing into the vaginal wall. Rectocele is the rectum pressing into the vaginal wall. And then uterine prolapse is the uterus falling down into it. The reason that any of those occurs typically during childbirth, the vagina can experience almost like stretch marks in the vaginal wall where the tissue becomes thin and then is no longer able to support the weight of that bladder. And so it can push in. Now, if you are having intercourse, it can still just push back. It doesn't actually cause any problems. The only time it really becomes problematic is when it's coming out,
Right.
which is very problematic. That tissue is not meant to be rubbed on underwear and pants. Doing that tummy tightening creates a negative pressure or a vacuum-like pressure that actually lifts all those organs up and helps them to stay up and inside. So that's really the best thing for those. If you have the rectocele,
I had all three.
I still have all three, but they're not problematic and I'm not symptomatic. So I'm not going to get them surgically fixed because I'm not having any problems. I can still have sex just fine and I still pee and poop just fine. And I don't leak when I go to Gravity Factory. So there's no reason for me to need them surgically fixed, but keeping that negative pressure, that tummy tightening helps to hold those up. What other questions are in there?
Someone said coconut oil is the breast lubricant. And then they informed us that they lost the video at one point.
Oh, sorry.
But yeah, that's everything.
Okay.
Anything else, ladies? Last call.
How about from the live audience?
Where are you?
Advanced physical therapy.
Which is just somewhere.
Right next to the hospital.
And
Just down
can
the
I
road.
just say, as someone who this actually matters to, insurance covers this, Medicaid covers this.
The pelvic floor
Therapy. To go in and have her actually help you to figure out all this stuff. Maybe you only need to go in once or twice, or maybe your issues or something where you need to go in more, but.
Nice that it's covered by the
Right.
medical.
Yes.
And we don't, there's never an age that you're too old for this. I've had 95-year-olds come in and work with me. I had a 75-year-old lady just the other day in 3 visits. She went from wearing a Depends every day with multiple pads inside that to not leaking anymore.
Wow. That's
Just learning how to recruit all these different muscles and going, oh yeah, I've never done that. Some people it takes a little longer, depending on if it's pain or incontinence or what the issues are, but often it's really pretty quick.
If you work it.
Can I ask another question? If you don't have insurance, what is the cost of a visit? Like,
An
idea?
evaluation is usually about $100 and then treatments are between 50 and 75.
So it's not out of the water. It's pretty reasonable. That's
That's out of the water for
Yeah.
me. Sorry.
Well, comparatively, I'm saying.
Compared to a
comparatively
physician visit or
Oh,
something
yeah.
like
I
that.
mean, because they could be way more than that, right? So,
If you do happen to have Medicaid, they cover it at 100%.
oh, good, good.
How many times a week do you typically, does it matter frequency wise?
The political answer is the research shows that 1 year out, frequency doesn't matter. They have the same outcomes. However, people get better faster the more frequent they come.
Okay.
I see people anywhere from 3 times a week to once every other week, just depending on what their schedules
Do you
are.
work with Stacy? I forget which one it is.
Yes. She recently moved to Idaho Falls and just barely stopped working with us.
She's my widow friend. So, I was at her wedding to her now.
I have a question about the visits.
Uh-huh.
Is the visits like just talking with you?
No.
I mean, you're gonna be on the table.
You
Like,
get
is
naked.
it?
You're
it's-
naked.
And the
You
whole
can keep
time,
your top
it's
on, but
totally.
I mean,
No,
waist down.
so the first 30 minutes is usually chatting, finding more out about trends, circumstances, so that I can really understand truly what it is that you're struggling with. And then absolutely a physical examination to determine muscle tone, just like I would with someone's back or their shoulder or their knee.
Yeah.
Figuring out what's going on, having you contract. Can you feel that? Can I feel that? Relax. Going through the different movements.
So it sounds a lot more awkward than it is.
We've all had babies. The awkwardness
Right,
is out the
like-
picture.